Dr. Myers, we're live now. You're on mute.
Thank you. Welcome back for another episode of Corona Conversations in the Black and Brown community. And today, as usual, we have another wonderful show. Today, this is our 28th session, and we will be focusing on substance use. So, as many of you probably know, we've had the shocking news that one of our fastest women in this country, Sha'Carri Richardson, was recently sanctioned due to the fact that she tested positive for metabolite of marijuana. She agreed to take a 1-month suspension for testing positive, even though we know that marijuana in no way will make you run faster. But it is one of the substances that is considered illegal by our U.S. Track Association. And of course, you know, your co-moderators are myself, Dr. Allison Myers, and my co-host, Dr. Maya Williams. And we always start off with talking about our latest stats in terms of COVID in this country. So we see that currently we have roughly a little over 33 million cases of COVID right now in the United States. And unfortunately, we've lost over 600,000 Americans. In terms of vaccinations, vaccination rates have continued to increase over time. We can see that among all ethnic groups, vaccinations have definitely increased since January, with our Native American population getting some of the highest rates. Granted, they are a smaller population in this country, and our Black and Hispanic populations are behind slightly, but we are catching up. And overall, we fell just short of the 70% goal of all Americans being vaccinated by July 4th. We were almost there. We were about roughly 67%. And of course, the newest and latest variant that we have now is the Delta variant. Initially last year when things were rampant, we had the Alpha variant. This new Delta variant is being seen worldwide. It's unfortunately decimated India pretty badly. And we can see that the United States also has pretty high rates of it, as does some other countries in Europe. And there are other parts of Asia that are slowly coming behind that are also developing more and more cases of it. And our head of our health committee for the city council, Mark Levine, recently tweeted that it's really important that if you hadn't gotten vaccinated before, you really need to be careful, because most of the hospitalizations that we're seeing and cases that we're seeing of people who are getting sick with the Delta variant are in those who are unvaccinated. And that's been seen in other parts of the country as well as here in New York City. And unfortunately, during this pandemic, we have seen an increase in substance use. And last year, it was reported that about 13% of Americans did endorse that they were using substances more during the pandemic around June of last year. And the pandemic has brought on an 18% increase in nationwide overdoses compared to the same time in 2019. The Centers for Disease Control, or CDC, and Prevention estimates that more than 92,000 Americans died of overdoses in the 12 months ending last November. The largest increase in overdose deaths was unfortunately among African Americans. There was a 50% jump from 2019. In Missouri alone, Black men are now 4 times more likely than whites to die of an overdose. In this study among patients with COVID, they found that those who are substance users tended to have higher rates of death due to COVID. And unfortunately, this was even more in people who were in communities of color when compared to whites. African Americans with COVID-19 and substance use disorder had a death rate of 12.99%, which is significantly higher than the rate of 8.57% in Caucasians with COVID-19 and substance use for the lifetime. Substance use has increased during the pandemic due to the fact that people have been feeling really stressed. The stress can come from the fact that people have lost their jobs, they've lost family members, also the isolation that's come with having to quarantine. And then, of course, for some people, they could not access simple things like stores to buy groceries. And unfortunately, this was leading to increased use of alcohol and cannabis. Here in New York City, alcohol was more readily available as you could use delivery services to order alcohol. And you could also get alcohol in restaurants, which was not something that you could traditionally do. You could actually get your alcohol to go. So there was also an increase of access to some of these things. So, who is most likely to be affected by an increase of substance use during COVID-19? Well, traditionally, we have seen that people of color have been most affected by substance use and unfortunately are less likely to get treatment. Minorities, unfortunately, are less likely to go to substance abuse more likely to use substance abuse treatment programs. Among adolescents, those who are Black and Hispanic have reported less specialty and informal care for substance use disorder as compared to their white counterparts. And the racial disparities that come along with substance use is not something that's brand new. This starts back in 1914 when there was the Harrison Narcotics Tax Act of 1914, in which people could use drugs for pain, but it was not, you couldn't use it to actually help people who had substance abuse disorders. Substance use disorders were not actually deemed as an actual disorder. And we know that over time, we've seen more recently policies under Richard Nixon, policies under Ronald Reagan, as well as Bill Clinton, have led to increased mass incarceration of people of color in disproportionate numbers. So I could have crack and I could have cocaine. And as a person who has crack, you can have the same amount of crack as someone with cocaine, and yet the person who has crack would have a heavier sentence. And a lot of these sentences were mandatory, such as the Rockefeller sentences that used to be here in New York, where they imposed minimums on sentencing for people who were arrested for substance abuse or possession. And we also know that with the 13th Amendment, slavery was deemed as something that was no longer allowed. However, as noted in the 13th Amendment documentary by Ava DuVernay, you can still have incarceration, which is almost like a form of slavery. And it's interesting that because a speech by our former President Barack Obama said, although the United States only constitutes 5% of the world's population, it has also 25% of the world's prisoners. This is the basis of the entire film and is followed with source-based information explaining what causes this alarming rate of incarceration. And again, this is the 13th Amendment by Ava DuVernay. And unfortunately, we also see now that even though marijuana has been considered legal in most places, including here in New York, the arrests that happen disproportionately will affect people of color as compared to white counterparts. And ironically enough, we are less likely to actually be able to own dispensaries and businesses that are allowing for the legal selling and distribution of marijuana. Mass incarceration that comes from these drug laws show that Black men are 6 times as likely to be incarcerated as white men, and Latinos are 2.5 as likely to be incarcerated as white men. We want to say thank you to people who have supported us. Today's show is sponsored by Ravens Way LLC, a wonderful vegan company. We also like to thank Dr. Naomi Maria, the Chayor, Jared Olivieri, and Richard La Rochelle. Raven Pereira, CEO of Ravens Way. Please follow us on Twitter at Minority Health 3 and also on Instagram at Minority Health Combos. So now for the good part, our panel. So first we have Dr. Sandeep Kapoor. He's an assistant professor of medicine, emergency medicine, and science education at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. He's also the assistant vice president of addiction services for the Northwell Health Emergency Medical Service Line and director of screening, brief intervention, and referral to treatment, also known as ESPERT at Northwell Health. He's the recipient of the 2020 Northwell Health's President Award for Leadership and received the 2020 Outstanding Mentor Award by the American Academy of Child and Adolescent Psychiatry. He's passionate about public speaking and writing. Dr. Kapoor delivered a TED-like talk titled Empathy Back to Basics for Today's Real World. He also was recently featured in Scientific America for a piece that he co-authored entitled Patient Care Must Include Gun Talk. Next, we have Ms. Trinae Sass. She's a mental health counselor. She graduated from Nyack College with a master's in mental health counseling. She has had 3 years roughly experience working in substance abuse, and she's worked with youth as well as adults. She's experienced both the inpatient and outpatient settings, and she's currently working as a mental health counselor at the Montefiore Medical Group, which is an outpatient treatment program for adults who suffer with both substance abuse and severe mental health issues. Her goal is to continue to work with this population and one day open her own practice or family shelter. Last but not least, we have Assemblywoman Alicia Hyman, who was elected to the New York State Assembly on November 10, 2015, in the 29th Assembly District, encompassing such neighborhoods as Laurelton, Rosedale, St. Albans, Adelaide Park, Hollis, Springfield Gardens, and Jamaica. She's the proud daughter of immigrants, and she immigrated to the U.S. from London. She spent her formative years growing up in Hollis and South Ozone Park, attending PS 34, IS 108, JHS 226, and John Adams High School. Prior to being elected to the state legislature, Assemblywoman Hyman worked closely with community stakeholders as an active member of Community Boards 12 Queens and 13 Queens, serving as a member of the Board's Education Committee and also a regular participant of the Rosedale Civic Association. She also sponsored a wonderful Juneteenth event here in Queens last month and has also put forth legislation to make Juneteenth a holiday here in New York. So without further ado, I turn it over to my co-host, Dr. Maya Williams, and the panel. Thank you.
Thank you, Dr. Myers. So the first question I have is for Dr. Kapoor and Trinice. I know, like growing up and even before, we always called it substance abuse for whatever reason. However, in 2013, the American Psychiatric Association changed the terminology from substance abuse addiction or alcoholism to substance use disorder. Yet individuals like myself still use the term substance abuse. So why is it important to change the term, and what is substance use disorder?
Thank you very much, Dr. Williams, and good evening, everybody. Thank you so much for the kind welcome and for having me here today. So I think we should just start off by just really recognizing and acknowledging how much words matter, especially around stigmatizing issues that substance use disorder represent. So the term abuse in itself has a negative connotation, as if someone is doing something wrong, which then if you follow that journey of thinking, it pretty much it justifies us as healthcare professionals and us as fellow members of society to think of substance use disorder or these struggles as the wrong decision by someone or a moral failing. So I think that the action to start normalizing language, to make it more person-centric, to really look at this as a healthcare issue and reframe the conversation as such will hopefully allow some sort of destigmatization. You know, communities of color, Black and brown folks, I mean, you name the culture, this is a stigmatized, taboo topic. We don't openly talk about this. This is not a conversation usually at our dinner tables. It's a conversation we hide under our dinner tables. It's a conversation we have with a lot of distaste, a lot of anger, a lot of frustration, especially when talking about loved ones. And the reality is, if we can at least start with simple steps like language, we very well can start shifting the narrative to actually look at this more holistically and hopefully partner to support someone with the science, you know, with the understanding of the science behind this chronic illness.
Thank you for that, Dr. Kapoor. That was a very great answer. I do like that words matter and words are important. And you did mention that there is stigmatization, and even with stigmatization, we know what that has done to individuals from the Black and brown community. So this question is for Assemblywoman Hyman. For policymakers, disparities in substance use, which has disproportionately impacted communities of color, has been a problem hiding in plain sight. What can policymakers do to address not only the systemic racism, but also the health disparities faced by members of this community by discriminatory laws and policies?
So thank you very much, Dr. Williams and Dr. Myers, for inviting me to this COVID conversations. And I think one of the things we cannot get comfortable with is that people think COVID is gone and we're all good, but what we saw was that it highlighted what we already know, the disparities when it comes to health in communities of color. And it's important of us to not go back to normal, but to recognize what's wrong and fix it. So to your question, we have a legislature now that has a lot more members that are from communities of color. We have 63 members, Black, Puerto Rican, Hispanic, and Asian members of the caucus. That is the biggest numbers we've ever had. And what we've seen is more legislation, is particularly legislation that was just passed in the Assembly and the Senate that ensures that the proceeds from the opioid settlement go to those communities that need it more. And what I say, it's millions of dollars that we're talking about. And because of what you talked about earlier, Dr. Myers, it's important that we legislate those dollars right down to the communities of color. Because what we've seen is that the numbers that you cited earlier about Black men, the disparities when it comes to deaths, the addiction, that we need to make sure that organizations that are in communities of color that have direct access to these individuals get that money. Like Dr. Kapoor said, we sweep this under the rug. But what we're seeing in the streets and neighborhoods is that addiction is there. It has always been there. It has been exacerbated, and it's on the responsibility of legislators, on the city, on counties throughout the state of New York, particularly in communities like Buffalo, Syracuse, Rochester, Albany, and the 5 boroughs where we see addiction spiking, where we're seeing addicts that had been addicts for years, drugs laced with fentanyl, and because it's in our communities, it may not be pursued as much by law enforcement. So having said that, this bill that was just passed that the governor hopefully will sign will make sure the monies come right down into the communities, to those organizations. I live right by JFK, so if you hear a plane or I can't hear you, please forgive me. We want to make sure the money comes right down into the communities to help combat addiction in our communities as we know it.
Thank you. And I do agree with that. We should definitely highlight that COVID-19 is not over, regardless of everybody wanting to have a hot boy and a hot girl summer, but it is still very much, and the Delta variant is right in our faces, and people need to as well get vaccinated if they can get vaccinated. And we do know, like you mentioned earlier, that COVID-19, we did see an increase in substance use during COVID-19. And so I'd like to ask this question to Trines. Many individuals who develop substance use disorders are also diagnosed with mental disorders and vice versa. COVID-19 has given the Black community permission to seek therapy as the world tries to process this pandemic. There's a decrease in stigma and increase in Black clients seeking therapy. First, what is the connection between substance use disorder and mental illness? And second, are more individuals from racial minority groups seeking treatment for substance use disorder, especially now during the COVID-19 pandemic?
Okay, so hi, everyone. Thank you guys for having me. I guess like the connection between the two, I guess one of the connections would be maybe like the environmental factors, such as like stress and trauma within the Black and Brown communities. And I forgot, what was the second question? Sorry.
More individuals from Black and Brown communities seeking mental health treatment for substance use disorder, now that we're seeing like everybody's talking about therapy, and therapy appears to be, on the verge of being normalized.
Yeah, yes, I agree that it does appear that way about counseling. I feel like during COVID, everyone had a lot of downtime, and with connecting with families, maybe different feelings may have arose, which gave people more opportunity to kind of seek therapy, because you have more opportunity to kind of focus on self versus, maybe going to work or doing all of these other different things.
Thank you. And this question is actually for Dr. Kapoor. Like Trinis mentioned, like a lot of individuals had downtime. And I know, especially my friends included, a number of them fought to engage in recreational smoking or drinking. And for example, some people indicate that they drink at night to take the edge off, or smoke marijuana because it helps with the anxiety, it helps to relax them and calm them. Now, what is the difference between using drugs recreationally and the point at which someone becomes an addict, and how has COVID-19 exacerbated excessive substance use?
Yeah, I think that's a great set of questions. I don't know if there's an easy answer, but I will say, and Dr. Myers demonstrated this during the opening presentation. COVID-19 has brought a lot of stressors, and unfortunately, a lot more trauma into our daily life. That the impact of social isolation, the financial stressors, the fear and the anxiety around family and health. These are all I would say mitigating factors that need to be considered when you think about the increase in alcohol sales, the increase in alcohol use, as well as the increase in drug use, which subsequently has led to an increase in overdose deaths. Dr. Myers mentioned the 90,000 plus individuals in this country that we've lost due to drug-related overdoses. Just to put that into context, that's almost 3 times the amount of people or 2 times the amount of people that we've lost during 20 years of the Vietnam War. And year after year, we're matching that number. And that's not including alcohol related deaths, which are close to 88,000 a year. We need to break this cycle. But in the reality of breaking the cycle, we have to acknowledge the trauma. And Trinae said it eloquently, that this relationship between substance use disorder as well as mental health, it is a very tight relationship. They travel hand in hand. And a lot of this is due to the trauma that someone may have experienced in their environment, in their own personal life. We need to acknowledge that, and we need to not just acknowledge, but we need to focus on that. There's a lot of drivers towards substance use or misuse or abuse, but we have to remember things are on a spectrum. And I would like to make this analogy about diabetes, and Dr. Myers hopefully would appreciate it, right? We can't just bucket everybody that may be dealing with the substance use issue and, let's say, quote unquote, call them an addict or an alcoholic. The reality is there's a lot of individuals in this country, everybody to a certain degree is on a spectrum of substance use disorder, from abstinence to dealing with an addiction. And the majority of people are actually in the middle, where people may be drinking, they may be drinking under the healthy drinking guidelines. People may be using drugs, but they're not seeing the consequences of that drug use impact their lives. So I think as we keep having these conversations, this open dialogue, which I think is really necessary and hopefully informative for others, we have to infuse patience, but also an understanding of what drives a lot of the behaviors that we demonstrate as individuals. Someone can have a glass of wine a night and it doesn't lead to consequences. However, somebody else may have tremendous consequences because of that glass of wine. And we need to understand where people are at and what's driving that substance use. Why is that utilized, let's say, as a coping skill, and building other coping skills with support and an understanding.
Thank you. And I do like that you mentioned that individuals have to be on a spectrum, and I do have a follow-up question reference that. So we've been on the spectrum that individuals are. Like, what if right now during the pandemic, an individual is like, I've never had alcohol or I've never smoked marijuana, but I do really want to take something to just take the edge off or calm myself, or probably drink a glass of wine, and that's fine. How would the person have to gradually increase, take alcohol or marijuana? Because I know that some people have addicting behaviors. So what advice would you have for individuals who probably want to try something out for the first time, but sort of have like an addicting behavior? And how would individuals know that they have addicting behaviors?
Well, I think the safest thing to say is moderation, right? And really keeping a keen eye on your relationship with the alcohol and the drugs. And I want to be clear about that relationship. It's a very important term that we utilize this, because many folks have great relationships with alcohol and drugs, and there's no issues whatsoever, consequences, if you will, no negative I would say, impact on someone's health or, let's say, their school life or work life. But then there's others that have a very treacherous relationship with alcohol and drugs. And, I believe the Assemblywoman said it right. Drug use has been around forever. And unfortunately, drug use will continue. The question is, have we changed the narrative enough to make it safe for people? Harm reduction. Can we talk about how it's important to understand moderation, to understand the risks, but then also to help prevent further progression of that utilization, which may lead to a substance use disorder? So going back to that analogy with diabetes, not everyone is dealing with diabetes in their life, but pretty much everyone's on a spectrum, right? And we're trying, in healthcare at least, to prevent the progression of that disease process, that journey towards, let's say, a diagnosis or high risk status. The same is for substance use disorder. What we're trying to do in healthcare is take vital signs, understand where people are at, what their relationship is with alcohol and drugs, and really try to partner to see if we can stop the progression of a potential disease process and keep them in a safe zone, or in a safe zone with reduced harm to themselves as well as to their families.
Thank you. And speaking of the impact that this might have on individuals for the rest of their lives, this question is for Assemblywoman Heineman. For those who have been arrested for drug offenses, they often have difficulty in gaining employment due to the criminal record. In the state of New York, how does one go about getting the record sealed or expunged?
So we were not able to pass, there was a bill that was before us before we adjourned on June 10th that would have allowed people to apply and not have to put down, like, block the box like they do in city council, legislation that was passed in New York City Council, that would have allowed individuals to apply for a job and not have to check that box that they have been arrested, formally convicted of a crime. That bill did not make it to the finish line this session. However, we were able to pass the MRTA, which is the Marijuana Reconciliation Taxation Act, which allows for the decriminalization part, which allows for expungement of conviction records for individuals. Now, this only applies, obviously, to marijuana. As you all know, and I think Dr. Mai said it earlier about the Olympic athlete who was criminalized. As we know, marijuana does not make you do anything fast, no matter how you take it, right? We know the medicinal purposes of it. Alcohol is something, I believe, and someone will correct me if I'm wrong, athletes are able to drink, have glasses of wine and so forth. Marijuana is from the earth. It is made, it is not, we know it can be mass produced. We know many companies are definitely making lots of cash because it's cash. You cannot put this money in a bank. You cannot, it cannot be traded on Wall Street. So we know a lot of individuals are making a lot of money. So the important part, sorry, there's a plane, excuse me. The important part is with the MRTA law, which is what Majority Leader Crystal Peoples-Stokes, why our legislation in New York State is different than other states, was a decriminalization aspect of individuals having their records expunged. There are many workshops that are taking place around the state of New York, most of them led by my colleagues, that will advising individuals on how they can get their records cleared, because one of the drawbacks originally was that you wouldn't be able to open a marijuana business or a dispensary if you had this record. So we had to get rid of it because we know, as you all have said, that we are 10 times more likely to be arrested and convicted and do time than our white counterparts. So we had to make sure that in the MRTA that was taken out. So while we are working on a lot of criminal justice reforms in state government, I am happy that the MRTA was passed this year and the decriminalization expungement part was a huge part of it. So for individuals that you know that may have been arrested for possession of marijuana, may have been arrested for the sale of marijuana, it is important that they know that in the state of New York, you will be able to sell it soon. So we want to make sure that you get your records cleared so that you can partake in all of this money that's about to be made. And we wanted to make sure that there's a set aside for minority Black businesses, Latino businesses in the state of New York, that they will be able to partake in the selling of marijuana, cannabis.
And thank you. And I think that's so interesting because I know when marijuana was officially said to be going to be legalized, a lot of people were saying that so many Black and brown people are in jail for having like such a small amount of marijuana on their body, but yet still when white individuals figured a way to make millions of dollars from it, then it was like all of a sudden let's make it legal and then shutting the Black people and the Black and brown people individuals out. So I'm very happy that you know, at least we're including them in the conversation right about now. And this question is for Dr. Kapoor and Trinace, considering that we've been talking a lot about the systemic racism and the systemic injustices. Minorities have been found to have a high of substance use and are also likely to complete, less likely to complete a substance use treatment program. These disparities are marked by systemic levels of racial injustice that moderate the prevalence of substance use disorder among minorities and the lower treatment completion rates. What are the systemic racial factors that impact substance use disparities, and how has COVID-19 exacerbated these disparities?
Again, I think it's a complicated question and by far a multifactorial, complicated answer. I don't know if there's a direct answer. I think Assemblywoman Heidman said it well, that COVID-19 brought to light the disparities that were already there, and they were all exacerbated without discrimination, pretty much. Everyone saw it, everyone felt it, and they understood that there are tremendous disparities in healthcare when it comes to communities of color. You know, I do think that we have to remember that just like how complicated this question is, same is substance use disorder and mental health. And it's not just about treatment at a facility. There has to be outreach, there has to be change within the community. There has to be investment in the community. There has to be the organization of better supports for that community in order for community members to be successful. You know, again, if we look at other chronic illnesses, when we talk about diabetes or cardiovascular disease, a heart disease, if you will, we talk about changing nutrition, but then it's one thing to have that conversation in a hospital. It's another thing to return back to your community and not have fresh produce, only have fast foods, or not having the financial means to actually afford healthier options, or not understanding someone's cultural diet and giving, you know, this generic information about how to change your diet, but maybe that doesn't fit into what you grew up with, what your comfort level is in terms of nutrition. Substance use disorder has to be approached the same way. We have to better understand the individuals for who they are, the environments that they're stemming from, and not stop our conversations within these quote unquote clinical settings, but really make sure that resources are available at the footstep of where individuals live. And the reality is we have not done a great job of that as a country, especially in communities of color. This is not something new. This goes for every chronic illness and every other racial injustice that we can link back to systemic issues. But if we're going to break this cycle, again, I think dialogue is really important, but action on that dialogue is equally, and if not more important. And what have we learned? We've learned that it is very difficult, for example, with substance use disorder, it is very difficult to be successful to gain recovery or well-being, or for some folks sobriety, to do it alone. And it takes partnership, just like it would take me to recover from a knee surgery. I'm usually not alone recovering from a knee surgery. I have health professionals calling me to check in how I'm feeling. I have family members involved. You know, I may have a friend that may help me out because I can't mobilize or walk. But when it comes to substance use disorder, what happens traditionally, we all back off. We all back off, we turn our eyes, our heads, we don't really openly talk about this to understand what someone needs to be successful. And yes, that's a systemic issue, but also I think we need to look at ourselves as individuals. It's also an individual issue about how we've approached this in the past.
Thank you. Trinace, would you like to piggyback off anything Dr. Kapoor said?
Yeah, I agree with him, especially when he says about like language or communication or just understanding about substance use disorder. I feel like a lot of families don't really understand what a person is going through who struggles with substance use. So it's difficult for them to support them in such a way. But I believe if we continue to have those conversations, then maybe it will become easier. But I agree 100%, like lack of support, definitely lack of resources. You know, I know a lot of individuals who are like in the shelter system where they're supposed to get the resources, but sometimes they don't get the resources. So I feel like lack of resource and lack of understanding about substance use in general.
You know, and if I may, Dr. Williams, just to piggyback Trinace, you know, these are things that we need to change, right? So again, Assemblywoman Hyndman said this before about where the funding goes, right? When funding is sought out or when the federal government opens up opportunities for grants, we really need to look at this from a population and community health perspective about communities in need. You know, there's been tons of money thrown in, and you know, my team here at Northwell has capitalized on this to build programs around the opioid epidemic. But the reality is, the opioid epidemic's been around for a long time, especially in communities of color. And unfortunately, there was no funding, there was no drive, there was no reality coming to fruition about building programming and support structures. You know, in saying that, now substance use disorder is affecting all demographics, but we cannot keep moving forward and think that we're going to change unless we really acknowledge that, yes, well before it's affected all demographics, it by far has disproportionately affected communities of color, and we need to appreciate that. But we also need to use it as motivation to act, to partner, to change. And you know, everyone that's on the Zoom today, as well as folks that are going to follow this later on and watch this later on, I think it's got to be a moment of empowerment. Like, we all have power in this equation when it comes down to changing that narrative and righting the wrongs of the past, and you know, replacing that despair and hopelessness that has shattered communities with actually hope and compassion and equity. So, you know, I don't think it's just up to elected officials. I don't think it's just up to healthcare professionals. I actually do think there is accountability for all of us in society to start shifting this narrative, to be there by the side of individuals that are suffering from a chronic illness and treat them and care for them with the same lens we do with heart disease and diabetes and cancer and other chronic illnesses.
I'm going to snap my fingers to all of what you just said.
Would you like to add anything to this, Assemblywoman Hyndman?
I totally agree with everything you just said, Dr. Kapoor. And it is the when I first got to the assembly, there was my colleagues who live upstate in Nassau and Suffolk counties were crying about the opioid epidemic. And my colleagues from Brooklyn were like, when crack was killing our communities, it was like, that's your fault. It's, you know, Black people don't know any better. And now the opioid is killing the young people, and you know, from opioid stems heroin addictions. It's like, oh, it's a health epidemic. So I don't need to preach to the choir. You all know, but now that we know, it is incumbent upon all of us, just like you said, Dr. Kapoor, that we have to make sure that as we talk about a harm reduction, you know, what does that look like for communities in Southeast Queens and Sutphin Boulevard or Guy R. Brewer Boulevard, or some places in Nassau and Garden City where, you know, it is a disease just like heart disease, and we have to make sure that we have those things in place. That means more beds. That means the accessibility. I don't think it's Narcan. It's another drug that's sometimes used for addiction or overdoses, but it's not given to usually communities of color. Like these, we have to stop this, because, you know, if just I have to shout out this quote to Saida Dunstan, who's the executive director of ELMCOR, who says, when the world catches a cold, Black people catch pneumonia, because you see it decimate our communities faster. And that is what we're seeing with substance use disorder, because I heard you say to Dr. Myers, and I said, I got to remember to use the right terminology, is that we have to make sure that we're fighting for those dollars to come down to our communities for more beds, for more, and that the people who are running these programs aren't like, and sometimes big organizations will capture that money and then we get the drips down into our communities. And that's why I was saying about the opioid settlement. It is so important that we equalize the access for curing of the diseases across the board and not just for one particular community. I have some friends who were in Harlem recently and they said they felt like they were back in the 80s. People were like zoned out. Because we're seeing it more so, the after effects of this pandemic and what it's done to us. It was always there, like I said, but now we're seeing it in our faces, and we may joke about it. We have those conversations under the table about so and so, Uncle so and so gets drunk at every family reunion. Uncle so is trying to get rid of pain or trauma. And he's using the alcohol to dull that. And that's something we don't talk a lot about. A lot of times these young people who were homeless during this pandemic were on drugs to dull their trauma, which put them on the streets in the first place. And that's something that the trauma we know leads to drug addiction. And this is something that all of us collectively have to work on, not just in the legislature. It has to be on the ground, from the governor's mansion, all the way down to, to Harlem, all the way down to Rochester, every MLK Boulevard. As Jay-Z said, we know there's a drug dealer and a drug addict, and we have to make sure that we're combating this on every level and not policing the drug addicts either, helping them cure this disease.
Thank you for that, Assemblywoman Heineman, which brings me into my next question. And I am prefacing this by saying I will butcher the name of the drug, but Dr. Myers or Dr. Kapoor, according to the Substance Abuse and Mental Health Services Administration, in 2017, non-Hispanic Blacks had some of the highest rates of opioid-related overdose deaths and total drugs deaths related to synthetic opioid use in the US. One of the explanations is limited use of the drug buprenorphine in lower income and Black neighborhoods. Can you explain how buprenorphine works?
And that's what I was trying to say. Go ahead, thank you.
How someone can receive treatment?
Sure, and I'll get started, but I really would love for Trinace to share her experiences with this as well. I think the reality is, and again, Assemblywoman Hyman, if you don't mind, I'm going to quote you. You used the word equalize, right? I think that resonates with me when I hear that word, because if we could keep equalizing this criminalized disease process and actually bring it back to the basics of a healthcare issue that is widely spread and has been debilitating our country, that's when we could really understand the synergies with other disease processes. Most chronic illnesses have medications available to support an individual for their health and their well-being. And again, I'll say diabetes and heart disease, we all appreciate, understand this. I mean, my 10-year-old understands this, that there's medications that grandma and grandpa take for their high blood pressure. Now, when you look, and if we are willing, and that's the key word, if we're willing to look at substance use disorder as a chronic illness, then we can appreciate that there are medications available to support individuals for their health and well-being as well. There is no magic bullet. There's no snap of the finger and X, Y, and Z and everything is resolved, but it is part of a plan that some folks may decide, if it's offered, to your point, it's not always offered. If it's offered, they may decide to bring that in as part of their journey towards well-being. The medication you mentioned, buprenorphine, there's many other medications. We may be familiar with methadone. We've heard this for years. These are medications to help someone with an opioid use disorder because the body has become comfortable with, let's say, the heroin use or the prescription pill use. And you need to satiate, or you need to resolve the body's need for that type of substance. It is a safer version of a medication. It is a medication, and it's safer for individuals as opposed to stopping cold turkey for many. For some, folks can just stop and wean off any drug use and they're fine. Others may need the support of medication, plus, let's say, psychosocial support, like talk therapy, CBT, and all that stuff. Now, unfortunately, there's a stigma around this as well. Just like there was with methadone, just like there is with buprenorphine and other medications, is that you're replacing one drug for the other. But the reality is, again, if we take a step back and look at this as a chronic illness, this is a medication that could support somebody, not necessarily be the problem solver. The disparities in access and offering, that's a problem we see with every medication out there, right? Just think about the cost of insulin, how much disparity that causes for the individuals that don't have the financial means to access that medication that's life-saving. And I know Dr. Myers talks about this all the time. When it comes to these medications, there's no different. Unfortunately, as a country, we follow the lead of these norms that the federal government, the big pharma, the lobbyists, all these different folks have really guided our thinking around this and force us to create this perpetuation of stigma as well as lack of access. So I don't think it's disproportionate to other medications, but yeah, the reality is there are medications available. They should be considered. They should be definitely widely be offered. And this is why I think it's amazing that Trinice is here to hear, at Montefiore has great programs around medication for addiction treatment. Probably the earlier programs in New York State to show success. People are successful with medications and seeking recovery. And I feel like I'm yelling. I'll stop yelling. I'm sorry. I feel like I'm yelling.
So I haven't had any, I'm going to just say the B word. I haven't had any experiences with the B word. I can't say it. In both of the clinics that I work for, including Montefiore, my patients have only used methadone. So basically they're assessed based on medications that they may take, for their regular health, like we were talking about diabetes or heart disease. And they're assessed, and like most medications, make sure that they don't, overlap or can cause, further damage. And then they're prescribed a specific dose amount, and it's to help them maintain or refrain from using, illicit drugs like cocaine or heroin. So that's been my experience. Everyone is pretty much on a different dose amount, and it's administered at the clinic. Due to COVID, and, depending on if a patient is able to manage without having to come into a clinic, then they'll receive like take-home bottles. But yeah.
I do have a question. It's related to the drug. So I listened to this podcast, Hidden Brain, and there was one time they had an episode on a drug called the Lazarus drug. And it was called the Lazarus drug because they said that they give it to individuals with an overdose and it raises individuals from the dead. So I don't know if that's the same thing. Is that the same drug that you guys are talking about? But they're basically saying that a lot of addicts sort of they overdose because they know that this drug is available, and so that they could rise from the dead. So I don't know. Could you clarify this?
Sure. So I believe you're referring to naloxone, which Assemblywoman Hyman mentioned before, which is also Narcan. It is the antidote for an opioid overdose. So that narrative is disturbing when I hear that about, folks may take advantage of the fact that this is available. I got to be honest with you, and personally, I feel differently. I feel that it is a rescue medication. And look, if someone is utilizing drugs, it would be preferred that they have it there, because the reality is saving that life saves the family, saves the community, saves the school district, and so on. So it does make a safer environment for drug use. And this is if we come to the mindset that, hey, drug use is probably going to continue, right? Now, another thing to think about, due to COVID, the drug supply chain was impacted. So rewind 16 months ago when we talked about naloxone or Narcan, we really were talking about opioid use, right? Heroin use, we're talking about prescription medications for pain and so on. But the reality is fentanyl, which again, Assemblywoman Hyman is really populating a lot of this conversation tonight in terms of the knowledge that's being shared. Fentanyl is a synthetic opioid that is cheap and easily manufactured and easily put into other substances. So right now in New York, as well around the country, regardless if you think that you're just smoking some weed or you think you're just doing some cocaine, you are at risk of an opioid overdose, because most likely, because of the supply chain issue, there's probably fentanyl in that drug as well. So it's really important that we do educate people about the skills on how to recognize an opioid overdose, how to prevent it, how to use an intranasal device, like a little spray that goes into the nose, which is Narcan or naloxone, to rescue somebody. But let's be very clear, naloxone is not going to treat an addiction. Naloxone would hopefully give us the opportunity to partner with someone to understand how to support them with their substance use disorder. Without that rescue medication, unfortunately, those numbers in the 90,000s, 80,000s a year are going to continue. And one more point about like using drugs and having naloxone there. You know, we distribute naloxone within our emergency departments free of charge, thanks to New York State DOH. We partner with them. We do education. We distribute kits. And there's a strategy behind that. It's about saturating the community, just like we saturate the community with automatic defibrillators and stop the bleed kits, you know, in malls at all these different stations. We need to think about what do we need to do to make our community safer for our loved ones, as well as other individuals that may be dealing with the substance use disorder. They're human beings as well. And the reality is we prescribe EpiPens, epinephrine pens for allergies or allergic reactions all the time. And I make this analogy, do people go home and jump into a bucket of peanuts because now they have this? You know what? Someone may do it, but the reality is we still want to save their life. Why would it be any different if someone uses drugs? Do we not think that that life is valuable enough to save? And I think that's a question for all of us personally to reflect on so that we can start changing some of this mindset.
Actually, I do have some, as somebody who has to walk around with an EpiPen. Earlier this week, my allergist was like, oh, your allergy to avocado is not as high. Introduce the allergy, you could gradually introduce avocado into your diet. And she's like, but don't go overdoing it just because you have the EpiPen. And it's like, I just bought 2 avocados today because I was like, I'm going back to eating the avocados and I'm using this EpiPen. So maybe that might be a bad analogy because I am guilty of that, but just wanted to let you know that I'm one of these people. So I just have a question for Trinice. We speak earlier, and I like that you all were talking about like the family and getting the family involved and getting help. And it's like, you know, such a community-based stuff. But what we find is that there are disparities in the care of persons of color with substance use disorder, and there are few persons of color who are actually working in this field. So how can one find a substance use provider from the Black and Brown communities?
That's a good question. I actually found my therapist on American Counseling Association, and she's Black. So I honestly don't really know, but that's just what I use. But I would assume that, you know, it will be similar.
Yeah, and just to build on that, I don't think it's an easy answer. You know, like there are registries, there are locators that you can look at by zip code, who's licensed and who can provide care, what organizations. The reality is, though, it takes some homework to really understand, let's say, what that person may look like and do they reflect your community. So some suggestions, and, you know, I actually asked my team this earlier today because there is no simple fix, but some of the suggestions were, you know, when you identify a facility, you know, many folks that are licensed, you know, they do have some sort of digital footprint out there, you know, to search them out, see what their background is, see what their interests are, and see if that matches what your expectations are. You know, the reality is we may feel more comfortable talking to somebody that may look like us, but at the same breath, we have to remember it may be really uncomfortable to talk to someone that looks exactly like us because we may have this fear of shame or stigma. I know that's true in the Indian community. Like, we do not talk about substance use disorder. I don't even think it's a term at this point. And the reality is, if someone who is Indian approaches, let's say, a provider or a practitioner that's Indian, that could be a conflict for them. They may not prefer that. So I think doing some homework and really understanding what's accessible. But the reality is, we need to build more diversity within our workforce. And this goes back to, again, Assemblywoman Hyndman, what she mentioned about equalizing. This is about raising the bar for education, for workforce development, allowing people to be part of this process, because we know how much the environment plays a role in this chronic illness. And I think we've seen tremendous amount of success. There's an organization called VIP, which is, I believe, in the Bronx. And they've done a great job of really bringing home this disease process, meaning going to people's homes and communities and bringing folks with lived experience that may be in recovery to help guide that individual that's in need.
I just want to piggyback on what both of you said. One of the things that I think when it comes to referrals, just like how you buy your car, you get your hair done, your primary care physician, a lot of us go through referrals. I think it's the same process when you're looking for a counselor or a therapist. Referrals, and then checking to see whether or not your insurance covers it, or seeing if it's a co-payment that you can afford, because some people will do sliding scales based on your income. And I think that we're not post-pandemic yet, but while people are going through this, there is a backlog of therapists that probably maybe they had a lighter caseload, but since this happened, the caseload, I'm sure, is even more, is heavier for therapists. I know York College has a licensed clinical social work program that they now have a master's social work program. And York College, which is right here in Southeast Queens, any support we can give CUNY to produce more therapists or more licensed clinical social workers is a plus, which is why, CUNY is always high on my list when it comes to making sure the dollars get there. The other thing is, I think about our public schools, in which a lot of our children had a hard time. And we forget, like, children need timeouts, not just for disciplinary issues, but because they need time just not to be in front of a device. And then how do they handle this pandemic? Because when they go back to school, for a lot of them, I have an 11-year-old now who's going to go back. She was fully remote. And the time that it took me to just, for her, I realized when she got to see her friends, how important that was to her. So imagine children who don't have the good socio-economic background and didn't get that. What do you think? They're going to look for avenues to dull their pain. And this is where we talk about the early stages. And I know you all are experts, but as a legislator, it's like we got billions of dollars from the federal government. We have to make sure it gets into our school system to help those children, because when they get back to full schedules in September, how do you think they're going to feel with one counselor in the building? Every day my daughter got on Zoom with her teacher, the teacher asked all of them, all 16 of them every day, how are you feeling today on a scale? That's not her responsibility. It should be outside of the academic part. It should be, how do you feel today? Let's talk about that more, because there's some children who are going to exhibit things. And what we don't want them to do is get to the point where they have to self-medicate, because we know what that turns into.
Absolutely. Absolutely. So I can't believe it, but the hour is just about done. Like, this was just such a great discussion. I just really want to thank everyone, Assemblywoman Hyndman, Dr. Sandeep Kapoor, Ms. Trinice Sass. You guys did a wonderful job. I think some of the great takeaways from tonight's show is that we shouldn't say that people have substance abuse issues. They have a substance use disorder. We no longer need to stigmatize people who have substance use disorders. It's no different, as Dr. Kapoor said, as the people I take care of who have diabetes or people with cancer or other chronic conditions. These are definitely chronic conditions that need to be managed. Unfortunately, we do have disparities in the treatment, whether it's the criminalization of people of color or it's even the treatment. We know that in certain neighborhoods, you can get Narcan or naloxone. So God forbid your friend or loved one is having an overdose and you can help them recover. But in other neighborhoods, you could not readily get it. We also know that there's better access to medications, which were mentioned by Ms. Trinice SAS, such as methadone, or Suboxone, also known as buprenorphine, which can actually help with harm reduction, which was discussed so saliently by Dr. Kapoor. And what we can do for people who have substance use disorders is to support them. Very often in communities of color, whether it's the Black, Latino, or Asian communities, substance use and mental illness are things that we don't talk about. They're very taboo. And that also leads to some of the disparities that we see in the communities of color versus our white counterparts. We also see that unfortunately COVID has highlighted and increased some of the rates of not only substance use, but overdose. So I think now that people are able to mingle a lot more, we need to make sure that we're checking on our loved ones to make sure that they're doing okay, because some of them may be masking anxiety, mood disorders with this increased substance use. And this increased substance use has been disproportionately seen in Black persons as well as in women. So don't think that just because somebody is looking really happy and engaging in social activities, that doesn't mean that there's not something else going on. A lot of people can hide these issues very well. And some people are still, as we call them, functional. And we don't want to refer to these people as addicts. These are people who have substance use disorders. So we don't want to say there's a drug addict. We also sometimes will call people derogatory names like crackhead, smackhead, things like that. But it's really not appropriate, because at the end of the day, we're all human beings and we all have vices and things that we're dealing with. So we really shouldn't be judging people based on their vice being substance use. Also, I just want to add that there is legislation coming forward. So for those of you who have been arrested, or people who have criminal offenses related to marijuana, the MRTA has been passed in our New York State, which is allowing for the expungement of marijuana offenses. So if you want to get a dispensary to make your money legitimately, you can do that. And hopefully this other law will pass soon too for other drug offenses besides marijuana, that we can actually expunge records. There are too many smart brothers and sisters out here that should be doing legitimate business instead of having to spend their life in jail or not being able to get real jobs because of the fact that they have felonies from drug offenses. We hope to see you for our next. Enjoy our summer. We know you do too. And for our back to school show. And of course, we'll have more wonderful shows in the fall, such as cancer, transplant, as well as our repeat of our Black Trans Lives Matter show. We look forward to seeing you again. Thank you again to our panelists, and have a good night. It's not over. Wear your mask. Stay safe.
Bye, everyone.
Good night.
Good night.
Thank you.